listener production.
Hi, Sasha Barbagat with you. Happy Friday and welcome to the briefing. Right now, dentistry isn't included in Medicare. That's something the Greens want to change. It sounds like a nice idea, but it means billions of extra dollars in taxes every year and potentially a whole lot more dentists. So where are we going to get the money and all these dentists from?
The status quo isn't working. We need to get to work on the solution, and the goal, the end point we are working to, must be universal access to dental care because the mouth is part of the body.
Bension Siebert interviews Greens Senator Jordan Steele-John in the second half of this episode. First though, Bension is here with the headlines. It is Friday, the 6th of September.
Good morning, Sasha. Starting today in Paris, where Aussie Lauren Parker has pulled off another record, becoming the first dual sport gold medalist in almost 50 years. It came only a day after she'd become the first Paralympian to win any kind of medal in two sports at the same games in decades. She finished silver in the women's H1-3 individual time trial yesterday. She's gone on to win the H1-4 road race. This comes after her gold medal win on Monday in the PTWC triathlon. Incredibly impressive stuff, Sasha.
Awesome for Lauren. Love to see it. We've also won another gold in the pool with Timothy Hodge claiming the men's 200-metre individual medley SM9. There's gold in the athletics too. Vanessa Lowe this morning set a new world record in the long jump T63. And we won bronze in the table tennis, going to Samuel von Einem. Now, there are just a few days of competition left, Bension. It all wraps up on Sunday night Paris time, so that'll be Monday morning our time at 4 a.m. That's when the closing ceremony starts. And this Paralympics is being hailed as really successful. Like more than 2 million tickets were sold to all the events. We had all these athletes competing. And I did a quick look back at kind of how the Paralympics started. And they actually kicked off in 1948, but it was kind of an unofficial Paralympics. It was called the Stoke Mandeville Games. And it was held on the same day as the opening ceremony of the London Olympics in 1948. And it was 16 athletes in wheelchairs who competed in an archery competition. But it wasn't until 1960 that the first modern iteration of the Paralympics was held. That was in Rome. That featured 400 athletes from 23 countries. And what we have now is 4,500 athletes from more than 160 countries competing in 549 medal events across 22 sports. So really cool to see just how far this incredible competition has come.
Absolutely. Now, Sasha, before we leave the games, we do have to discuss an absolutely horrific story that's happened overnight. A Paris Olympian has allegedly been murdered. The Ugandan runner Rebecca Cheptegei, who competed in the Paris Olympics last month, has died after she was doused in gasoline and set on fire. Police say Dixon Endema set her on fire with gasoline on Sunday afternoon. She was 33 years old.
Back home now, National Cabinet will sit down to discuss new funding to fight domestic violence, but it is expected to come with a rebuke to the states. Almost all of the states and territories are lagging in their commitment to deliver more frontline staff, with 198 hired out of the 500 workers promised. Despite that, Anthony Albanese is expected to commit an additional $351 million towards frontline services. Now, it is understood the states will then be asked to match that commitment based on their populations, which would bring the total cash injection to over $700 million. This package is in response to recommendations made by a rapid review of prevention approaches, which called for a significant funding uplift in frontline services. Now, to paint a picture of just how bad it is on the front line of domestic violence services, Bension, Women's Legal Services Australia did tell the review that over 1,000 attempts to receive assistance were turned away during a 5-day period. And that means an estimated 52,000 people were turned away every year, which is staggering. So this money is desperately needed. And, we talked a lot at the start of this year, remember domestic violence was really in the spotlight. There were marches and Anthony Albanese made all these commitments. And these are the sort of things that he's promised to start doing. So hopefully we see a successful result at National Cabinet and this funding gets approved.
Now to the US, where Donald Trump has pleaded not guilty to revised federal charges against him over allegations he attempted to interfere with the 2020 election. The Republican presidential candidate himself wasn't in court for the hearing in Washington. His lawyers entered the plea on his behalf. Trump had to be re-indicted last month after that Supreme Court ruling in July, which we've discussed on the show before. That gave former presidents broad immunity from criminal charges for basically anything they do using presidential powers. The original indictment was found to feature some allegations that Trump, as an ex-president, would be immune to under that ruling. The judge presiding over that case says she will not let the 2024 election schedule interfere with the court proceedings.
This comes as Trump quietly pulls back his campaign efforts in a few states that he was targeting just a few weeks ago. So this is Minnesota, Virginia and New Hampshire. Now, he had been bragging that he was going to be able to win these against Joe Biden. But now that Kamala Harris is the candidate, it appears he's not so sure, and there has been some polling to suggest that she's pulling ahead in the race. So instead, what he's doing is putting a huge chunk of his resources into these battleground states. There's 3 of them where we're going to see this play out: Pennsylvania, Michigan and Wisconsin. Also today, Trump has announced he'll appoint Elon Musk to lead a government efficiency commission.
I will create a government efficiency commission tasked with conducting a complete financial and performance audit of the entire federal government and making recommendations for drastic reforms. We need to do it. Can't go on the way we are now. And Elon, because he's not very busy, has agreed to head that.
Because he's not very busy. Sasha, we did an episode, you'll remember, on Elon's conversation with Trump on X last month, where Elon just wouldn't stop bringing up this efficiency commission idea and casually mentioning how he would be happy to help with it. It seems that he's got his wish there. There are big questions, though, about the commission and Elon's appointment to it. What is it actually going to cut, for one? And number 2, can Elon actually sit on it without divesting from his business interests? Because there's a whole lot of laws and regulations about who gets to be a bureaucrat in a commission like this. And I really cannot see him giving up Tesla, X, SpaceX and his other companies to be a bureaucrat in Washington.
And heading across the ditch now, a new Māori queen has been anointed. Now, what you just heard there was the moment that 27-year-old Ngāwai Holoi Te Pō was selected as Queenie, which is the Māori word for queen, after her father's passing. Now, she was chosen by a council of chiefs, and what's interesting with this is that 2 of her older brothers were widely tipped to take the role, but they have been overlooked.
Ngāwai is the 8th Māori monarch and the 2nd woman to take the role, the first being her grandmother. She has been blessed with the same Bible that was used to anoint the first Māori king back in 1858.
Yeah, so the Māori monarchy is one of New Zealand's most enduring political institutions. It's called the Kingitanga, and it was founded in 1858. And this was established to try and unite Māori people under a single sovereign. So at that time, they were trying to stop the loss of land to colonists, to maintain law and order, and to promote traditional values and culture. It's worth noting it is a pretty ceremonial role, but it has been acknowledged by New Zealand's PM, Christopher Luxon. He welcomed the Queen, saying in a statement, she carries forward the mantle of leadership left by her father. So really cool. And the footage, I was watching a lot of the ceremony of what goes on to anoint a new monarch. And yeah, really beautiful, lots of amazing outfits and ceremonial dress. And it was really, really cool. Hey, Bension, thanks so much for being here for the headlines. Next up is your deep dive with Greens Senator Jordan Steele-John on why the Greens want to include dentistry in Medicare and how they plan to do it.
This week, the Parliamentary Budget Office released costings for a Greens plan to add dental to Medicare. On the face of it, the fact that a whole major branch of healthcare is just not part of the public healthcare system has always seemed a bit weird. But adding it now, according to these costings, would mean billions of dollars in new government spending. And the Australian Dental Association says we just don't have the number of dentists required to do it. On top of that, if you've tried to get an appointment with a GP or been anywhere near a hospital lately, you'll know that the public healthcare system is already in crisis. So how would it cope if we added a whole new category of medicine? Jordan Steele-John is the Greens Senator for Western Australia. Jordan, thanks so much for joining us on The Briefing. To start, could you just explain why dental isn't on Medicare in the first place?
Well, it does seem quite wild that we are here in 2024 and Medicare doesn't treat your mouth as part of your body. Like, that is just so odd. The history of it is shrouded in a lot of mystery. It seems like when there were original conversations in the 70s around what the scope of the first version of Medicare would be, as part of those negotiations, the teeth and the mouth just kind of fell through the cracks, right? And although that seems pretty odd, I think there's a point that's made even in examining that, which is the teeth are treated as not part of the body because there is an underlying belief in politics and in some parts of the community that your oral health is a reflection of your moral health. That if you have bad teeth, it's because you've made bad choices. And therefore, it's easier for politicians to not cover dental because they can kind of hide behind those assumptions. And that is kind of, I think, one of the reasons why still today we have a system that doesn't recognise teeth as part of the body.
So the Greens want dental added to Medicare. Give me the elevator pitch. Why?
Because it is too expensive to go to the dentist right now. We have 60% of people in Australia delaying needed dental care because of the cost. And that is resulting in people living in ongoing pain. We're talking about chronic headaches. We're talking about unbearable toothache. We're talking about not being able to eat. And that's just not okay. You should be able to get the healthcare you need, and all you should need to get it is to bring along your Medicare card. The Greens have made progress in these areas in the past. We were able in 2010 to get dental access expanded for kids, and now we want to ensure that everybody can actually access the dental care they need by just rocking up with their Medicare card.
Let's talk about whether this is practical. The Australian Dental Association says there's just not enough dentists in Australia to deal with the kind of new demand that would come from adding dental to Medicare. And as you know, the Parliamentary Budget Office assessment of the policy says, quote, "It's highly uncertain that there would be sufficient supply of qualified dental professionals to meet the increased demand." So where are we going to get all these dentists from?
I think the first thing that I would say there is we need to kind of ensure that we're not making the assumption that there are a whole bunch of dentists working in the system now that wouldn't be willing to work under a system where dental care was brought into Medicare. Having said that, there's definitely going to be a period of transition, right? This would be one of the largest expansions of healthcare in Australia since the establishment of Medicare. I can tell you we'll need everybody in the room working together, the ADA, the public dental representatives, public health experts, community planners, to ensure that we get this right. It's not going to happen overnight, but it really is one of those situations where nothing changes if nothing changes. We have to begin the work now because we can't have a situation where so many people aren't able to get access to this type of healthcare, because at the end of the day, your mouth is part of your body.
It wouldn't just be a matter of the existing dentists doing more public health care. According to the Parliamentary Budget Office, there would be a utilisation rate that goes from 45% now to 85% in 5 years. That's a whole lot more dentistry being done and a lot more dentists that you need. Where are you going to get them from?
So we definitely can achieve it, and we can also make it more doable by supporting other types of oral and dental health specialists to work to the top of their scope of practice. So we have not only dentists in Australia, we have wonderful oral health practitioners, dental hygienists, and all of these professions can be supported under this model to take on the roles that they are capable of doing because of their training, but potentially aren't supported to do because of regulation or compensation structures.
Is there a number? Do you have any kind of estimate on the number of dentists we'll need?
In terms of that particular figure, that's something that we'll have to arrive at as part of a negotiation with the profession and an identification of where exactly the scope of practice for the other roles within dentistry land, because depending on those outcomes, that will kind of shift the extent to which dentists are required, oral health practitioners are required, dental hygienists, etc. What I am quite confident about, though, is that we have many thousands of excellent dentists in Australia. People are coming into the profession. That's a wonderful thing. The problem here is not that there are not enough dentists for the need within the community.
But the Australian Dental Association has said that there is a workforce issue here, and they say it's not feasible for us to have enough dentists to deal with the demand. Are you saying that it would literally be the current dental profession, basically the current number of dentists and dental hygienists in the system at the moment, they would be taking up this extra demand?
Well, I've had the opportunity to work a lot with the ADA over the course of the inquiry and beforehand. I really value their perspective on these issues. The bottom line is this. The situation as it currently exists is not acceptable. It's not working. It's not okay that so many children, particularly in Northern Australia, have all of their teeth removed before they turn 7. It's not okay that a witness who came before our inquiry told a story of how they had given a toothbrush to a child, and it was a Spider-Man toothbrush. He was very excited to receive it. It was the first toothbrush he had ever received. He went home, came back the next day without his toothbrush, and the practitioner asked the child, who was below the age of 10, what had happened to the Spider-Man toothbrush, and he said, I gave it to my brother because my teeth are already ruined, but he's got a chance. That's not okay. So the status quo isn't working. We need to get to work on the solution, and the goal, the end point we are working to, must be universal access to dental care, because the mouth is part of the body. The status quo cannot be allowed to remain.
How much would it cost and who would pay for it?
$78 billion over the decade is what the Parliamentary Budget Office has come back with. And we proposed to pay for that by the implementation of a financial transactions tax, or a Robin Hood tax. So that would basically mean that people engaging in financial transactions would pay an additional charge, and that would be kind of grouped together to cover substantially the cost of the proposal. Even the ADA, for example, will openly admit that Australians every year pay $818 million for dental care, giving us one of the most expensive dental systems in the world. We outrank America, actually, per capita on the amount that individuals are required to spend on their dental care. And the other thing that we need to consider there is the impact on the mental health of our community through unaddressed dental and oral health care. Not only the chronic and constant pain with which people are forced to live every single day, but also the sense of shame and the sense of failure that is brought into people's lives because of unaddressed dental health, whether it be people that have lost their teeth due to cancers or due to other illnesses and are constantly reminded every morning of that awful moment in their life, whether it be folks that have been through the justice system where the only response to any form of a dental ill health that can't be cured with a Panadol is to whip the tooth out, and then have to have themselves reminded of that every day. This is really having an impact in people's lives, and those things need to be considered in the context of the overall cost.
In terms of the overall cost and the overall healthcare system, the Health Minister, Mark Butler, says that his focus right now is strengthening the fundamentals and in particular strengthening general practice. We all know that general practice is in a state of crisis at this point. It's hard to get a bulk billed appointment for anyone. If we've got that, we've got ramping right across the country in major hospitals. The public system already isn't coping. How is it going to deal with a whole new category of medicine added now?
It's a really good question because the fundamentals of what you've just said there is absolutely right. Our public healthcare system is under incredible pressure at the moment, and that is being felt by the people that work day in, day out in those systems and the people that rely on them. And the problem, I think, at the core of this strain is that there are so many parts of the healthcare system that don't communicate with each other and literally leave whole sections of the body out, dental care being one of them. Now, one of the things that people might not expect or might not know is that poor dental health, poor oral health, has significant flow-through health impacts in the rest of the body. It's been conclusively linked to heart disease, problems during pregnancy, dementia, malnutrition, as well as the mental health impacts that we discussed earlier. So having that unaddressed causes people to then require other supports and often more acute supports from the health system. So we absolutely need to make sure that we support general practice and ensure that those aspects of our healthcare system are functioning and people are supported at the same time as we close some of these massive gaps in the system, because those gaps are creating additional pressure.
Jordan Steele-John, thanks so much for joining us on The Briefing.
Thank you so much.
Jordan Steele-John there. That's it for this episode of The Briefing. We would love it if you could share this ep with someone you think might enjoy it. And if you want to keep up with our other content, you can check us out on Instagram at The Briefing Podcast and on TikTok and YouTube. Just search Listener Newsroom. We'll be back in your feed this afternoon from 3. I'm Bension Siebert. Catch you next time.
Listener.